tonight we have Dr. Brett Shapiro. I mentioned to Dr. Shapiro, one of the reasons I asked him to do this particular talk was we hear from people in the community. We hear from the people who are dealing with this stuff, and his name came up to me 2 or 3 times where people had expressed gratitude for the information and the strategies that they were given by Dr. Shapiro in his practice. And so it's been a while since I heard that, but I always keep that. I always kind of tuck that away so that we can have people that can benefit from it later. And so we were so appreciative of your being willing to do this with us tonight. And I would like you to tell folks a little bit more, especially those who are going to be listening in later. Please tell them a little bit about what it is you do and, your areas of specialty and a little bit about your practice. So I'm going to turn it over to you, and we won't start quite yet with your PowerPoint. We'd love to hear you first describe yourself, and then we'll ask you to do your share.
Sure. Is everybody hear me okay?
Yes.
Okay. Thank you for the introduction. I'm a child psychologist. I've been in Nashville since 2007. I moved here following a residency I did in Cincinnati, Ohio before. I moved here in 2007, and I've been in private practice pretty much since. My expertise is with children and adolescents. I predominantly work solely with that population. I do a lot of therapy, a lot of counseling, a lot of family work. I do a lot of work with kids with ADHD, which we're going to be talking a little bit about tonight, anxiety, depression. And I also do a lot of psychoeducational and psychological testing as well, too, looking at different behavioral concerns, identifying different disabilities or disorders. And so I do that as well, too. So like I said, I've been in private practice since 2007, and it's a little bit about me.
Thank you so much. And so we're eager to hear the information you're going to share with us tonight. So if you would go ahead and hit share screen.
Okay. I think we're there, are we?
We are there. And okay. The control is yours now to advance your slides as you are comfortable.
Sure. Well, thank you so much, everybody. I guess if you have questions and you can hold them off, I'll be definitely able to answer all your questions and everything like that. So I'm going to talk a little bit about ADHD and youth. Some of the things I'm going to talk about are the diagnostic criteria for ADHD, ADHD versus bipolar disorder. There's a lot of individuals who have bipolar disorder also have symptoms of ADHD as well. So I'm going to talk a little bit about the differences between those. I'm also going to go into some discussion about helping parents of children and adolescents with time management skills and organization. Those are I chose to talk about these because these are big areas that most individuals with ADHD struggle with, is time management and organization. So I'm going to talk a little bit about that. And then I'm also going to talk a little bit about the treatment for ADHD, different behavioral treatments, different treatments I use, and also a little bit about some medical treatments, medications to help with ADHD. And then at the end, we'll discuss, I'll answer questions and kind of go from there. So I guess the first thing I want to discuss is a little bit about what ADHD is. First, before I go into it, I want to decipher and discuss a little bit about ADD, ADHD. A lot of people have confusion about that. People don't understand, like, it's now called ADHD, and the H is in there for the hyperactivity component. But with ADHD, you can be predominantly inattentive type, predominantly hyperactive impulsive type, or a combined type. So even if you have ADHD, you might not have the hyperactivity component, but still it's called ADHD. You might be ADHD predominantly inattentive, predominantly hyperactive impulsive, or a combined type, which is both of them. So the first symptom is of ADHD is inattention. So along with that, you need to have there are 9 symptoms of ADHD or inattentive symptoms. You need to have an individual has to have 6 or more of the symptoms that have persisted for at least 6 months, and it negatively impacts on social, academic, and occupational activities. So some of these symptoms are often fails to give close attention to details or makes careless mistakes in schoolwork or during other activities. B, often have some difficulty in sustaining attention in tasks or play activities, difficulty staying focused in lectures, conversations, or lengthy reading. The third criteria for inattentive is often does not seem to listen to when spoken directly to. And the fourth area is often does not follow through on instruction and fails to finish chores, schoolwork, or duties in the workplace. And then often has difficulty organizing tasks and activities. Messy, disorganized work can be an example of that. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. Schoolwork, homework, preparing reports, completing forms, often loses things necessary for tasks or activities, often is easily distracted by extraneous stimuli, and often forgetful in daily activities. So basically, these are all the characteristics or all the symptoms of ADHD or inattentive type ADHD. And to have the inattentive type of ADHD, you have to meet six or more of these symptoms. In terms of the hyperactivity impulsive component, again, you have to meet 6 or more of the symptoms. Again, like the inattentive component, they have to have persisted for at least 6 months and negatively impacts on social, academic, and occupational activities. So again, as you can see on the page, these are some of the symptoms that make up that hyperactivity impulsivity type. Fidgeting, tapping with hands or feet, squirming a lot in the seat, basically hard to sit still is an example of that of the hyperactivity component. Often leaves his or her seat in situations where remaining seated is expected. Just impulsive in that sense. Gets up often, hard to sit down, hard to settle, driven like a motor, which I'll get into later. C, often climbs or runs about in situations where it is inappropriate. Limited to feeling restless in adolescence is the identifier. Often unable to play or engage in leisure activities quietly. Is often on the go, acting as if driven by a motor, unable to be still for extended times. And I use this example a lot with parents when I talk about this, is that a lot of times, if you think about a child with ADHD, if you think of a CD spinning in a movie player, it just constantly goes and goes and goes. And that's what I've noticed a lot in kids with the hyperactivity component, is that just always on the go, very fast, hard to slow down thoughts. Things are going so fast, almost as if driven by a motor. Often speaks excessively, often blurts out an answer before a question has been completed, completes people's sentences, cannot wait for turn in conversations, a lot of interrupting, just having to speak excessively, often having difficulty in waiting his or her turn while waiting in line, and often interrupting or intruding on others. So again, 6 or more of these symptoms for 6 months or longer will meets that kind of criteria for the hyperactive component of ADHD. So basically, for the diagnostic criteria for ADHD to be present, several inattentive or hyperactive impulsive symptoms were present prior to age 12. And one of the most important things is that for ADHD to be present, it has to manifest significantly across environments. Meaning a child who has impulsive issues, hard to focus, for instance, at school, but this is not occurring at home, that's not ADHD. It has to be across environments, and it has to be occurring significantly across environments. There is clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. So in a sense, it's interfering in different areas. Mostly with kids, it's obviously going to be more academic areas. With adults, more occupational hazards. And the symptoms do not occur exclusively during the course of another episode, such as schizophrenia or another psychotic disorder, and are not better explained by another mental disorder. So in conclusion, kind of to what ADHD is, and like the full definition, there's 3 diagnoses of ADHD. There's ADHD predominantly inattentive type, ADHD predominantly hyperactive impulsive type, and ADHD combined type, which is again meeting all the symptoms of inattentive and all the symptoms of hyperactive would fall into that combined type. According to the NIMH, between the ages of 13 and 18, 9% of American children have ADHD, and boys are 4 times more likely to be diagnosed with ADHD than girls. And typically the average age, they say, begins at around 7 years old.
Dr. Shapiro, would you mind if I stop for a few questions on this
Sure.
this segment?
Sure.
So it sounds like what you're saying is we no longer use ADD. We just use ADHD and acknowledge it as inattentive. Is that correct?
Yes, that's correct. And like I said, it's really confusing because, I'll have a lot of families. Even today, I had a family that came in and said, well, my son is ADD. And then I said, okay, but it's, and I explained to them, I understand, but it's now called ADHD, predominantly, like you said, inattentive type, predominantly hyperactive. So yes, so it is confusing because you have that H in there, and the H will always be in there, but the individual may not be hyperactive or impulsive. So that's where kind of the confusion comes in.
Okay. And then my other question would be that we know that boys are diagnosed more than girls. Even though they may be diagnosed, do we think that the prevalence may be, closer to the same, but girls are not getting diagnosed, or it's just not as prevalent in girls?
No, I think it's more the latter. I definitely see that it may be diagnosed more in males, but I do see that a lot of females have it as well too. So I would say it's more even than that. Okay. At least what I'm seeing.
Okay, thank you. I appreciate that.
No problem. So I just kind of wanted to wrap up and talk a little bit about the symptoms of ADHD. And these are just some other symptoms, more broader symptoms. Easily distracted, consistent switching of attention from one task to another, trouble sitting still, blurting out, interrupting, jumping from one object to another, object to object, just hard to stay focused in one area, talking nonstop, or not showing regard or concern for other people's emotions or feelings. So I wanted to talk a little bit about ADHD versus bipolar disorder. This is a topic where I could probably talk about for 3 hours because there's just so much to discuss about it. So I kind of want to hit hit the main points of it. In looking at bipolar disorder, bipolar disorder is basically defined or manifested by extreme mood swings, abrupt changes in one's energy level, distorted decision making. So the way it is, it's characterized by intense highs or like more or less euphoria, irritable periods, and those periods are called manic periods. And it's also characterized by intense lows, which are feeling down, feeling sad, more the depressive type symptoms. So bipolar disorder, and you can think about it, bi means two. So in poles, there's two opposites. There's an intense high or a manic period, versus intense low, which is a depressive type period. In children, bipolar behavior appears to be a chronic mood dysregulation with a combination of elations, depression, and irritability. So there's just, I think mood instability is a good word. Dysregulation, meaning it's never really consistent. In depressive periods, which I'll get into too in a little bit. Depressive and manic periods could last for weeks. So, and it could be very random or cyclical. Symptoms that can both be present in ADHD and bipolar disorder would be high levels of energy, a reduced need for sleep, a difficulty concentrating, and both can affect someone's ability, obviously, to carry out tasks and being easily distracted. What differentiates more or less ADHD from bipolar disorder? Individuals with bipolar disorder can, like I said, can have an elated mood or grandiosity. What I mean by grandiosity is just, just these big flights of ideas. Like I remember one time working with a child or an older adolescent that was struggling with bipolar. He would talk about these lavish trips that he would want to go on and these things. I almost felt like he was in a sense in a manic phase there, because some of the things that he was talking about were just a little bit, just very grandiose. ADHD symptoms are chronic. That means that they're ongoing. They continue. Bipolar disorder is characterized by episodic shifts. So it's not necessarily ongoing. They're different different shifts in individuals' behavior. Like I said, extreme highs, extreme lows, symptoms come and go in cycles. It's not ongoing per se. They go, then they stop, then they can become, something can trigger it where it goes into another cycle. They're here for a while and they disappear. With ADHD, the symptoms of distractibility, impulsivity, and hyperactivity, restlessness are always present and can be influenced by one's environment. With bipolar disorder, the cycles of highs, lows, and normal periods may be irregular. So it's not always present. It could come and go without a clear pattern. And like I said earlier, it may last for weeks as well too. ADHD typically develops in young age, while bipolar disorder typically occurs at a later age. Excuse me. I had read a stat, and I don't know, I've got to look kind of more back at it, but I read something where they said the average age of individuals with bipolar disorder starts at around age 25. That could be true on the grand scheme or grand scale, kind of, but within like the populations that I work with, I see quite a lot of older adolescents that struggle with it, or symptoms very consistent with it. ADHD is more common than bipolar disorder. Roughly 9% of children have symptoms of ADHD, and roughly 2.4% of the population have symptoms of bipolar disorder. Manic periods is sometimes mistaken for hyperactivity, because when you're manic, you're hyper, you're elated, grandiose mood, kind of correlates a lot to the hyperactivity component of ADHD. And the low periods are sometimes mistaken for inattention, or a lack of motivation, which makes sense because when you're feeling down and you're feeling gloomy or feeling depressed, focus is definitely affected by that. Your ability to focus on tasks, ideas greatly diminishes when you're feeling down. So, there's definitely that correlation, which are common in individuals with ADHD. Kind of a review, like a differential diagnosis, ADHD versus bipolar, what kind of separates them. Bipolar symptoms are seldom apparent at birth, but develop over time, unlike ADHD. Bipolar impairment is more chronic and debilitating. In bipolar disorder, mood dysregulation is random or cyclical, not situation. That's probably the biggest difference, is that in bipolar disorder, it is completely random or cyclical, meaning you just never know. And ADHD is more kind of situational, and ADHD is, like I said, more common, more prevalent. The feelings of grandiosity within bipolar disorder, individuals with bipolar disorder experience limbic rage or mood shifts that are rapid, intense, long-lasting, and highly destructive. And I think a good example of this would be, and I've heard this description a lot from families. A teen with bipolar disorder can rage for hours in a destructive or disturbing way, described as volcanic rage. It is really intense. I've worked in residencies, and internship. I've worked with individuals that have been hospitalized, that have come out of these, and we're talking very destructive, very disturbing rage, very angry, very aggressive. Walls could be punched. We're talking about that type of rage. A teen with ADHD may have tantrums or be upset, but generally they'll stop if distracted or something else, or if they become tired. The rage is a lot shorter with individuals with ADHD. Yes, I have families that'll tell me that, their ADHD child will have tantrums and it'll last for hours and hours and hours. But it's a different type of tantrum, and it's generally on average shorter, with individuals with ADHD, because generally they will tend to pass out soon too. So I guess
So Dr. Shapiro, thank you for that. I think what we see most commonly with the families that come through, we don't see, because most of the families that we're working with tend to have kids that are a little older, but those that do have children with ADHD, it's definitely the things that you're describing are things that they are impacted by, their children are impacted by. With the bipolar disorder, I agree with you. It's that we usually see it in late teens. The only time we really see the rage is if it goes untreated. Usually they catch it before it goes untreated. If it really gets to a full-blown, as some of our families will describe it, meltdown, then that's when they're going into hospital. That's when they're going into crisis care, and usually will have an intensive, may have an intensive stay. But I really do appreciate you differentiating the two, with something that is cyclical versus something that is ongoing. I think that is helpful to us.
Well, and it's really confusing because I'll have a lot of families that'll come in and be kind of confused about the two. And there are a lot of similarities, but there are some major differences too in that. I'll have families that will come in, or I'll talk to families where they'll describe these characteristics, but it sounds more like ADHD. It sounds more like inattentive symptoms or hyperactive symptoms. It also with bipolar, like I said, it's cyclical, but usually the periods of manic or depressed last for extended amounts of time. So it's, so sometimes, I'll have families that'll come in and just they won't know if they kind of meet that criteria or it's
Right.
something else. So yeah, it's definitely I see it more in older adolescents. I mean,
Mhm.
that's what I'm seeing a lot of older adolescents, a lot of mood dysregulation. But again, you have to differentiate between the two, and
Right.
testing usually helps with that too.
Mhm.
So, all right,
Thank you.
right, keep going on.
Yeah, thank
All
you.
right, all right, sure. The next area I kind of wanted to talk about, we're kind of going from bipolar. Now we're going to talk a little bit about like different areas that you as parents you can work on with your children in terms of having ADHD. So, like I said earlier, the two big areas that are affected a lot by having ADHD are the time management skills and organization. And I'm going to talk about both of them, but they generally go hand in hand together. So I'm going to talk about some like different time management skills, and then I'm also going to talk a little bit about organization. Like I said, you might hear some overlap, but that's going to be pretty common with it. One of the major areas under time management, the first thing is organize, organize, organize. And I always kind of question to parents, like, what does being disorganized mean to you? Because everybody's definition is different. I've heard, you know, the room not being the room not being clean as like the main area of like that's it makes me crazy because it's disorganized. Then I'll have other families where it's completely different, like all the rooms are chaotic, there's things, it's just chaos. So thinking about what does being disorganized mean to you? um there's two different types of organization. There's the spatial organization, and that's in a sense keeping one's physical space in order, especially when doing homework. That's really huge with kids with ADHD. You want to make sure uh, that where your child works, it's an area where it's free from distractions, things like that. So it's really easy to focus on, easier to locate materials, less distraction, more time to work, and great for locating materials. I thought this was interesting. Like this is pretty much a great little diagram of pretty much what ADHD looks like. Lack of organization, books all everywhere, computer on the floor, the bed's not made. Now, again, not every child is like this, but I do see a lot of children that have this much problems with organization and keeping things together. There's also informational organization, and that's more or less color coding, which I'm going to get into, color coding books to help children better with their attention deficit, different binders to use, different folders to use, and I'll get a little bit into that as we go on. Some organizational techniques. I do a lot of work with kids with with ADHD in terms of trying to help them better organize, especially for school. And I've also talked with my kids about different things that'll better help them. Children are very visual. They're very creative visual individuals. They need to see things. So, I do a lot of color coding with books, with notebooks. So what I'll do is I'll talk to the families and I'll ask the child, when you think of English, what is the first color that comes to your mind? And, most of the time you're going to hear a color, obviously a color of some sort. So what I do is I kind of I work with them, work with individuals and parents on color coding different notebooks just to make it easier for the child. Like I said, children and adolescents are very visual and creative beings. I also like to divide the notebooks, so I'll work with the families on organizing notebooks. Having tabs for notes, having tabs for quizzes, tests, syllabus, assignments. Obviously, this is all for organization. It's to help better, and it's which then affects time because you're able to manage your time better. Like folders, homework sheets completed. So basically putting kind of everything together in those folders and having the notebooks very clearly organized. And these are things that I discuss a lot with families because, like I said, organization and time management is a huge factor that affects a lot of kids with ADHD. Underneath that, time management techniques. It's very important to balance work and play. You want to spend your time wisely. Discipline, 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 the 3 Ds. Figure out what needs to be done and set a time to do it. I just thought this was a great little tidbit of information I saw that the average human being loses an hour a day due to disorganization, which comes to more than 2 weeks a year. So, I mean, that would be a pretty nice vacation. And it's crazy to think that we lose an hour a day due to just not being organized. And yeah, that'd be a nice little vacation to take. So, so let me move it. It's hard for me to read because the thing is at the top. Hold on a second.
Okay.
Let me just, there we go. All right. Yeah. Put everything in its place and get ready before. So again, let's make it less work. Let's help the child become more organized. How do we do that? Well, you may have like a mudroom for shoes. When the child comes in, he immediately takes his shoes off. He puts them down as opposed to running all over the house with his shoes on or doing whatever and then throwing them in a room, one shoe in a room and another one, and then organization is gone. He's lost his shoe. So shoes, I'm sorry. So having a place maybe to put your shoes, a place for your backpack when you come in, putting your dirty clothes in a hamper or washer, picking out clothes the night before. I was very religious with that. I think my parents probably instilled that in me about picking out your clothes the night before and being ready in the morning. That way you can sleep a little bit longer. So make it easy for yourself. And you're able to find things much easier. Have an alarm set in the morning is another example. Prioritizing your time. What can wait and what is a priority? I'm a big fan of to-do lists. Write down what needs to be taken care of now immediately. What can you do during the week? And what is an ongoing project or long term? So along with that goes into the idea of procrastination, which is another thing that I talk a lot about with kids because that's a huge struggle is putting things off into the last minute. So an example, take care of things immediately would be like if you have a quiz or test the next day. Do that, make sure you're prepared for it. Do during the week. Like during the week, every night reading for maybe 20 minutes. That's consistent throughout the week. An ongoing or long-term project could be an assignment that's due in 3 weeks. And I usually work with children on each night doing a little bit. So that way, when the 3 weeks is up, they're pretty much done with everything and they don't have to procrastinate or they don't have to wait till the night before to do everything. Helping your child prioritize, which in turn helps them manage their own time. What is important to commit to each day? What is important? Is it family time? Is it play time? Is it extracurricular activities? Make sure the schedule is organized. And then that way it makes it much easier for your child or your adolescents to be able to function better. I'm a big fan, especially, and it doesn't necessarily, a child doesn't necessarily have to have ADHD, but it really helps a lot with this, is having a weekly meeting, like a meeting with parents to discuss what the week ahead looks like. So a lot of times with families, we'll work on having a day during the week where everybody gets together. It might be an hour, it might be a half an hour, where you're looking at the week ahead. You might have a dry erase board. You might document each day what your child has, but in that way, it keeps everything organized. Like example, swim, if the child has some sport or dance, church, counseling, different activities. It's visually there. I do it a lot with dry erase boards, just because the child then can see what they have every day, keeps them organized, and helps with time management. And also, a weekly meeting will help prioritize time to get things done. So, what do you have coming up on Friday? What do you have coming up on Thursday? We'll look at the calendar. Everything is right there laid out. How do you feel when you have more time to do things? I mean, most people feel pretty good when they have more time to do things. So, that's kind of what this leads to. How are you going to feel when you have more time to do things? If everything is organized, makes time much easier. Create a study zone that fosters learning and focus. Some children prefer silence. Some like music in the background. I'm talking about studying. You want to create a zone that's easy for your child to do his work, but you also want to create a distraction-free environment where there's just not a lot of stimulus around, because then if there is, then the distraction gets much higher and it's really hard to stay focused. If a child is not completing homework in an appropriate amount of time, you want to readjust the working environment. I do a lot of 15 minutes on, 5 off, 15 on, 5 off. What I basically mean by that is, some people are born with the gift that they can sit and study for an hour and a half straight and not take a break, and they're fine. That is really uncommon. Most people can study for a good amount of time, but they need breaks in between. So I work a lot with children and adolescents on reinforcement schedules during the evening with homework, in terms of, let's work hard for a certain amount of time. We have to behaviorally figure out what that is, then take a small little motor break or a short break, maybe a 5-minute break where you're just stretching, you're drinking water, you're training, you're relaxing your brain to start over again. So it's a 15 on, 15 off, 15 on. And it depends. I mean, I tailor that to the individual and what he can do. I have kids that can last 20 minutes. I have kids that can last 7 minutes. So it's just, we work on that we work on that together, and it's measured, so then we can determine what we need to do. I do not recommend beds or couches to study on. I'm not a big fan of kids studying in their rooms, simply because the room connotates a place to relax, a place to sleep. So psychologically, if you're laying in your bed doing homework, I just don't know how long that's going to last without falling asleep. And couches too. Couches are great, but you're going to get too relaxed on a couch. You may. So I always recommend being in an area where you can sit at a desk. There's limited distraction, and you've got the ability to communicate with, ask questions or ask your parents if you have questions. Use the correct time management tools. These are just different ways to kind of help organize and help with time management, using calendars, timers, watches, clocks. Planners are huge. Thanks to my father, I still use a planner. I still write all my my schedule, and I don't use a computer for that. I write everything down because it's just much easier for me to follow. look at the month view, which helps make time less abstract. Kind of look what the individual has in store for the month, or what's going on. And older kids can use a calendar application on their computer, which can sync with a phone if they have one. So then they can kind of put everything together. I'm just not a fan of using my phone to schedule or put things in, because if that gets lost, then you've lost everything. That's why I like to write everything down. Balanced screen time, that's a huge area as well too. Xboxes, Wii's, PlayStations, iPads, I mean, these are all one of the biggest time generators for children. Gaming and doing that. So working on boundaries and balancing screen time. Is it a daily use of playing video games, screen time, or weekend use? Is it a reward? Is it a path of least resistance? What I mean by that is, it's much easier to let Bob go ahead and play his video game for 3 hours, because then I can do my thing around the house. That's kind of more a path of least resistance. Is it affecting homework status? The added age of being outside is important. And I think we've lost that art, because a lot of kids like to stay inside and play video games. If there's not a sense of balance, then that's usually what happens. How is time spent? If getting good grades is a priority, but they spend more time playing games, then schedules definitely need to be adjusted. What if there's no downtime because of so many activities? Then maybe more free time needed. So it's all about a balance. Using deadlines. Use a timer for chores. It's more or less using a timer. I recommend more of a timer if you're studying, so you can make sure you're getting the amount of time in that you need. If it's 8 minutes of focused study, we want to make sure you're getting in that amount of time of it. Implementing a reward consequence system for not making deadlines is another thing as well that is utilized a lot with children with ADHD, and the need to be responsible. I could stop now if there are any questions, or I don't know.
I had a question, and maybe somebody else does. So I've been the one asking questions. Is there anybody else that has a question? All right. My question is, if you're doing like the 15 and 5 strategy,
Yeah.
do you ever run up against the fact that you've got a kid, if you give them 5 minutes, that's, during that 5 minutes, is that unfocused time? Because I would think with some kids, they might just, boom, take off and not come back in the 5. How do you keep that so they stay within the structure?
Yeah, and that is definitely a tricky one, because the 5 minutes definitely wants to turn into 10 minutes, which definitely wants to turn into 15 minutes. Like I had earlier today, I had a child, we were talking about it, and during his breaks, like he would go outside and play basketball, and I thought that was a good thing, but then I thought more about it and realized, he'll never want to get out of that habit. He's going to want to stay out there and play for longer and longer periods of time. So what I generally do is, on the break, I make sure the break is pretty much contained within kind of the area. So if he's at the kitchen, he may get up and get some water, or he may run to the bathroom. It's pretty much contained, and it's not a break where he goes and watches TV or he does something like that, because that'll just get him off track. It's just more of like a quick, like little motor break, and it might not last 5 minutes. It might be less than that, but that's kind of one of the big areas that's difficult, is what they do during that time, that 5 minutes or 6 minute time or whatever it is. So yeah, we talk a lot about that. Okay. Anything else?
No.
Oh, okay. So I'll go on a little bit more. Managing children's time in the morning and following school. And when I say child, I mean children, adolescent as well. as well. Um, you know, I'm big at charts. So because like I said, and I've said a few times, kids are visual, adolescents are visual. So making a chart of like morning expectations. So example may be like a chart of expectations. Wake up, brush teeth, take shower, get dressed, make bed, comb hair. It's routine. Now things may change, but generally it's a script for being able to what to do in the morning. In a sense, it becomes routine, it becomes rote. The more you do it, the easier it becomes, and then it becomes routine. Stickers, rewards, praise. I talk about that a lot too, because a lot of ADHD is doing different token economies or reward systems, um, and praise is really huge along with that. You want a reward for progress, not perfection. Nobody's perfect, but if they're making an effort and things are going forward, you want a reward for that. The more you reward, the greater the likelihood the behavior is going to happen again. After school, spend some time with your children, talk, have a conversation. That's a little tricky too, because you got to be careful what you ask a child when they leave school, because if you say, how was your day, what's the typical response? Fine, good. It's a closed-ended question. Do you want to I always kind of I utilize some questions I encourage parents to ask, where they have to give, where it's an open-ended question. Tell me about 3 things you did in school today. That forces the not forces, but the child is not going to say fine or good. It opens up conversation. Um, Take a break before jumping into homework. That's a big thing too. I I always want to do what is in the best interest of the child. Some kids like to come home and do homework right away. Some kids like to take a break for a bit. My kind of feeling, and what I've noticed over the years doing it, is that kids do a lot better when they come home from school and take a break. It may be a 30-minute break, it may be a 45-minute break. That would be the time to go out and shoot baskets. You've been in school for 8 hours. So why come home and then do another 2 hours right when you get out of school? Take a little break, regroup, maybe get a little snack, depending on what the rules of the household are, which is what we discussed. Then then we get into the kind of the homework, or when that starts. Um, kids need to play, they need to run around, they need physical exercise. Um, Going outside during school for 20 minutes is great, but they need a little bit more than that. So I definitely encourage like more active play and doing things. And obviously that's going to depend, if there's a function in the evening with the family, then the child may have to do homework right when he gets home. And that's fine. I always want to do what's in the best interest of the child, whatever works for the child. After dinner, schoolwork, chores, you want to set this precedence. I put no computer games, Xbox, PlayStation. I think that's obviously something that can be discussed. You know, I do have kids that play half an hour after they do homework at night, and that's totally fine. I think it's dependent on the family, and kind of what those rules are. Set some breaks, set some motor breaks, breaks to stretch, breaks to kind of move around, not breaks to go outside and play basketball for 30 minutes, but just, you know, stretching a little bit. I do that a lot with my testing. When I'm testing kids, I'll take a break after a bit of time, and I'll say, okay, do you need a break? And yes, take a break, regroup, get some water, go to the bathroom. All right, let's get back to it. Determine where to work, not near games. Again, limit the distraction. I had a child that came in, or a family came in, and the child told me that he has ADHD, but he's able to really focus when he listens to music and watches TV and then does his homework. I don't, that's a lot of distraction. I don't see how that would be, how that's not going to affect some of that. You make the bedtime choice. Like, you're the parent, so you decide on that. Quiet time before, I always encourage reading a little before bed, writing, listening to quiet music. The TV is very stimulating. Video games are very stimulating. They're very visual spatial. So you want the brain to cool down. And when you're doing video games or watching TV or listening to or watching something on the TV that's loud or something, that's going to trigger more things. And it's not necessarily a great aid to calm a child down. Charts as well too. And charts are more for tracking progress or different charts for different things that are coming up during the week. Organization, how have individual, I just kind of went through some.
So Dr. Shapiro,
Yeah,
I just want to let you know that you are at 7, and we're at 7:30.
Oh, okay.
And so, and if we want to make sure we do get to, your strategies are fabulous. We want to keep that going. But if there's something that you want to make sure you focus on, then I want to make sure of just letting you know so that you can
no, thank
orient
you for
yourself.
letting me know. I want to go into kind of more of the treatments right now,
Okay.
because I think that'll be helpful. So let me see. Oh, I just thought. So basically, I had a picture that the question before was, what does it mean to be disorganized? And then I had a picture of my son when he was a kid, kind of looking like that. I just thought that was good. All right, let me go into, here we go. All right, so yeah, I'll go into a little kind of the different treatments for ADHD. The first thing I kind of want to talk about and these are some things that I do with individuals, with children and adolescents for ADHD. I work on a lot of home interventions, being routine, having a schedule. I've noticed, like I said, ADHD is more kind of a disability, or not a disability, but a lack of organization. So maintaining a daily schedule to be able to know kind of what's expected, set small and manageable goals. You want to reward positive behavior, have a reinforced behavioral schedule for homework, which is what I talked about earlier, just 15, 20, whatever on, then a little bit of break. Different reward charts to increase behaviors. Keeping distractions to a minimum, charts and checklists, setting limits, boundaries, and posting rules. You want to provide feedback. One of the huge things is slowing down how many instructions you give a child, because if you ask a child with attention deficit to do 4 things at one time, chances are he's not going to be able to do those 4 things. The difficulty comes in if he does 2 of them but doesn't do the other 2, and then the child comes down. That's not defiance because he didn't do the other 2. He's not. It could be looked at that way, but it's very hard to follow multi-step instructions when you have attention deficit. So I always say, specifically, have the child do 1 thing at a time. When he's able to do that, then build up to 2 things. But I need you to go upstairs, grab the towel, bring it down, then get your flip-flops, then take your backpack to your brother's room, and then get in the shower. I mean, these are all, it's too much. You want to build a sense of structure, a predictable routine, and you want to repeat. I talked a little bit about earlier a weekly meeting, so I don't need to kind of get more into that, but that's a common a treatment tool I will use, helping to prioritize time to get things done. Some different school interventions. Tutoring is a huge thing. If a child is struggling in a certain area or even having trouble, as we've discussed, with focus, doing tutoring is a huge thing. Separate classroom to complete quizzes, tests. That a lot of children with ADHD have specific accommodations in the class, and which could include having additional time or a separate location to complete the tasks. Highly encourage meeting with teachers in the morning to go over assignments. It doesn't have to be the morning per se, but really working with your child on being independent and responsible, and going to the teacher on breaks or maybe even during a lunchtime to go over things, or if the child is confused about something. Preferential seating. They used to have like, and they still do, like ADHD desks I've seen, where if children are very hyperactive, there's a thing kind of at the bottom of the desk where they're almost like rowing on the desk. I've heard mixed reviews of that. To me, that would be very distracting to other kids, but I have heard of children utilizing this quote unquote ADHD type desk. Having the individual repeat what is said so there's an understanding of what was heard, that is huge. So if you're in another room and you're screaming to your child to come downstairs, you don't necessarily know that the child is listening. Even if you're face to face with the child, unless the child hears what you're saying and is making good eye contact with you, it's hard to know whether or not their mind is somewhere else. Now, I'm not saying you have to have your child repeat everything that you say all the time, but on stuff that's really important, I think that would be that's very important. Other continued interventions for ADHD, psychotherapy, and in a sense, exploring upsetting thoughts and feelings, working on different emotions. I do a lot of CBT, cognitive behavioral therapy, which is basically working with a child and adolescent on thoughts and feelings and how this affects behavior. We challenge a lot of inaccurate ways of thinking. We work on organizing different tasks, like I've been discussing for schoolwork, a lot of self-praise, rewards, other interventions for ADHD, social skills training, working with individuals on maintaining social relationships. Not necessarily, it is building friendships, but more the ADHD or the attention aspect comes in terms of like turn weighting, sharing. Those are big areas. Parent skills training, giving parents tools and techniques to help with the child's behavior. One of the hold on a second. The biggest area, or one of the most researched areas, or one of the kind of the areas of ADHD treatment, is a lot of parent training. So teaching or training the parents on how to work with their child who's struggling with attention difficulties. And that's where we talk about different like tools, different reward systems, different token economies, different ways to increase behavior, or what you're looking for. The last area is medications. I'm not a psychiatrist, so I mean, I don't prescribe medications. However, I do have a lot of kids that I see in my office that are using different types of psychotropic medications to help with ADHD. Stimulants, basically what a stimulant does, is it increases the amount of serotonin and dopamine, neurotransmitters in your brain. Non-stimulants are a little bit lighter. There are side effects to these medications. And usually what I'll do is I will talk to the parent or the child about how they're feeling, but make sure I definitely have a release to be able to talk with psychiatrists if I need them, or pediatricians, to make sure that we're doing whatever we can to best help the child. So any questions? Again, I could talk about this for hours and hours. So
Well,
yeah.
you've given us such a tremendous amount of information. I think it's very, very helpful. And I think the people that are going to be listening in on this will be picking up. You've got some themes here, which I'm definitely picking up on, which are certainly, creating a place and a space that doesn't have distraction, but also making sure that, and with whatever you do, you're building in breaks. And you describe them as motor breaks, and I think that's so important, so that they're getting up and moving. I mean, these are things that we see across the board with the mental health conditions for children and adults that we work with, is that it's not just your mind that's affected, it's your whole body, and it's a very holistic thing. And so that is definitely something that we look at. And I don't know if people are aware that NAMI has something called NAMI Basics, and you mentioned parent training. And so NAMI Basics is a free 6-session class given by other parents of kids with special needs. And it really is, one, nice to know there's other parents, because I'm sure this stuff can feel so isolating. I'm sure your families feel that isolation sometimes, like they're the only ones. And they're not, because you see so many of them. But it is nice, some of the strategies and stuff that are so helpful. And medication sometimes, it's so individualized, like you said. And so it's really nice to hear that you make sure you're working with those other professionals, the medical professionals.
Yeah, I mean, and it's tough because it's like I said, I have a lot of kids who do take medications, and at times there'll be questions asked about it, and I'm careful to say, this isn't my area of expertise. Yes, I know a lot about these medications, and I do, because I've dealt with them so much, but I think you have to be able to monitor everything and make sure that that the dosage is correct, making sure that they're seeing their doctor, but also making sure that they're taking the right medicine if they need to be on something.
Yeah. I think a statistic we've heard, and actually we have next month Dr. Joseph Pandit, who is he's board certified in psychiatry, but he's a pharmacologist, a doctor of pharmacology. And he comes out twice a year and does a Q&A with us and information. And so he is someone that somebody can ask questions of, and it's wonderful to have any of you that take the time with us. We so appreciate it. Has anybody else got any questions? I've been the one to have them, and I always do. I always have questions. So Dr. Shapiro, we're getting close to time where we would stop. Is there anything else that you think is really important for us to know?
Well, I mean, that's a good question.
That's a loaded question, isn't it?
I mean, I just think I think the biggest thing is not assuming the worst, because I do have a lot of families that I do see, and there is concern with ADHD, but it's not ADHD. So I think the most important thing is really, I try to educate parents a lot about what it is. In a sense that, yes, it can be treated, and yes, it can be difficult at times, but I just think I see more chaos, if that makes sense. Just unstructured, just things are kind of everywhere. It's a lack of organization, which I've been talking about. So I try to really that's why I kind of beat that down, because the more organized you are, the easier it's going to be, and routines and structures are just so important with these.
What percentage of parents of kids that you are working with, what percentage of those parents would you say have ADHD, because we know with most things that we deal with around here, it's very often there's a strong, genetic following, I'll say.
Well, and that is true. I mean, there is a high genetic component to it, but also a lot of adults were never diagnosed as a child.
Right.
So, that's a big thing. I do test adults as well with ADHD. And, one of the main things I talk about is, their inattention as a child, and a lot of times I was never, assessed. They never came up. So I think it's a lot of, I wouldn't, it's underdiagnosed in the sense that a lot of adults have it, but they just have never been diagnosed with it. So, and that's a common question I'll ask to parents is, is there a family history of it? Did you struggle with attention difficulties? And a lot of responses I'll get, yes. Typically somebody in the family, not all the time, but typically somebody in the family is struggling with it. But on occasion I'll have nobody has ever had issues with it, and you question it too.
There is a book that I really love, and I don't know that it was written specifically for ADHD, but it makes me think that it is. And it's a children's book called My Mouth is a Volcano.
I've heard of it, yeah.
And so we have a copy at the office, and I just love that book about blurting and the different things that that may come. Do you have any other books that you would recommend to families?
Yeah, like I a book called Driven to Distraction.
Yes.
That's a real good book. Rate and how I could Driven to Distraction is a real common one. I do have a few recommendations that I often talk to parents with about. That's one I've recommended a lot, because it talks a lot about the ADHD brain and how it affects, and I think a lot of parents seem to really like that book.
Well, good.
And I can email you like the name of it, and that way, if you want to send it out to people, that whatever you'd like.
That would be great if you want to send that to our program manager. Don Liacano is the one that communicates with folks, so we will certainly include that. And given that we are at about 7:48, I think we are going to thank you so much for all that you have put into this and all that other people are going to get out of it. We really, really appreciate the time and effort that's gone into preparing this for us. And we encourage people who may be listening. Don will be putting this up on our YouTube site. He'll give you a little more information about that. And we have at least 23 other titles and presentations that have been given over the last 2 years that you can find on the NAMI Davidson YouTube page. And so this will definitely be added to that as a resource to the community. So, please join me in thanking Dr. Shapiro tonight. We really do appreciate the time.